What is arthritis? All right. Firstly, arthritis, from its original translation, means arthron, joint, itis, inflammation. So when you think about tonsillitis, you've got inflammation of the tonsils. You think about appendicitis, you've got inflammation of the appendix. So arthritis is inflammation of the arthrons or joints. So arthritis is an inflammatory condition associated with joint breakdown deterioration. Of course, that's the classical definition using its origin word. Really what we need to know is arthritis is a multiple range of conditions. I mean, there's hundreds of classifications under the umbrella of arthritis, and most of them relate to joint deterioration, such as osteoarthritis, bone deterioration over time, rheumatoid arthritis, an autoimmune inflammatory condition that alters also the joints, but then you also have polymyalgia, which can be associated with muscle. So it is a complex, wide-ranging global term of inflammatory and degenerative conditions associated with breakdown and disrepair of the body, usually affecting mobility, joint function, and pain levels also associated with emotion and emotional state of a person. It's massive, it's huge, but it's an incredibly important condition in today's society. Who gets arthritis? This is actually a really, again, broad spectrum question, because most people immediately will jump to the conclusion, well, as you age, you're likely to get an arthritic or degenerative condition. And that's only in part true. And the reason it is generally and commonly associated with the aging population is because, well, as you age, you normally do lots of crazy things like have falls and bumps and spills, take medications and eat the wrong foods and have lots of stress, and that leads to breakdown and disrepair of the body. And we see that manifesting maybe in an arthritic or degenerative condition, except for the fact it's not only the aging. You can get rheumatoid arthritis as a young person, you can get as a child, juvenile rheumatoid arthritis as a young person in their 30s, and you can have it in your mid 40s as well with, say, arthritic disc degenerative condition. So it's a broad spectrum, multifactorial condition that affects lots of people, lots of age groups in lots of different ways. What are the signs that I have arthritis? Well, if you have advanced arthritis, you generally know because there's a significant amount of pain and inflammation and soreness, and it's impacting your health and quality of life. But really probably what the key distinction is, how do I know that I have started to get arthritis, might be, I don't feel like I used to feel, I don't move the way I used to move, it's not effortless, it's not easy, I feel like it's creaking and grinding. And a really early example of that might be, I toss and turn and I find it really difficult to get comfortable at night. It's like restless legs, and my partner says, well, you just lie still. Why do you always have to be rolling around? And that's a really early indication that there's some degenerative and inflammatory processes happening in the joints. The signs are you might find it difficult if you have arthritis in your hands, moving your hands or lifting things, bending and carrying. All of those signs are that your body's starting to change, and it's wearing, and the inflammation is impacting your mobility, your function, and your pain levels. But it's huge. There's so many symptoms.